Do you have head and neck pain from falling asleep? Unfortunately, this is a common problem. Many people look for global reasons for these pains, but often it is due to improper postures and sleeping habits. How to sleep and how to get a good night's sleep without harming the spine tell us in this video. What does the quality of sleep depend on? An important role in the process of sleep plays a hormone melatonin. Thanks to him, we fall asleep quickly and sleep soundly all night. If the hormone is missing, people wake up in the middle of the night and cannot fall asleep for a long time. Unfortunately, people themselves with their habits harm their own bodies, reducing the amount of melatonin produced. And the main reason for this is alcohol. There is a common misconception that if you drink a little bit before going to bed, you will have a long and deep sleep. In practice, people do fall asleep quickly, but in the middle of the night they wake up and can't fall asleep at all. Another bad habit is overeating before going to bed. First, it takes time to digest food, and during this time you cannot fall asleep. And secondly, a full stomach in a lying position will put pressure on the internal organs, which also will not be the best way to sleep and well-being for the body. From the last meal to sleep, at least 4 hours should pass. But the most important problem is improper sleeping positions. Everyone understands that they threaten limb numbness or vertebral pain, but mistakenly thinks that this is the end of all problems. In reality, the constant sleeping in the wrong posture leads to chronic fatigue syndrome, reduced immune system resistance, and serious health problems. What sleeping positions can harm you? Among them, unsurprisingly, a number of popular ways to position yourself in bed. Firstly, it is sleeping on your stomach. How dangerous is such a position? It leads to overstrain of the lumbar and cervical spine. A special load falls on the iliac, groin, and staircase muscles. Continuous sleeping in this position increases the risk of developing intervertebral hernias. People usually bend one leg at the knee for stability when lying on their stomach. But since the back is significantly inverted in the spine, there is increased pressure on the knee joint. This results in a lateral deformation of the knee joint and compression of the meniscus, which causes it to dry out and crack. The second popular but unhealthy sleeping position is lying on your back. It is in this position that snoring most often occurs and apnea develops, which leads to short-term respiratory stoppages, pressure spikes, and provokes microinfarcts and microstrokes. What is the best sleeping position? We'll tell you about it right now, and at the end we'll point out 2 important nuances that most people simply forget about. The best position to sleep on your side. It does not matter which one, but it is important in what position the legs and arms are. If you try to lie on your side with straight legs, you will feel that it is difficult to hold that position. This is because of the increased load on the lower back. If your legs are bent at the knees, the center of gravity is shifted and the load is distributed on the thighs and the lateral surface of the body. Additionally, you should put your arm so that it is bent at the elbow and with the forearm resting on the bed along the head. This creates an additional stiffening rib for the cervical spine. This position will save you from stiffness and neck pain in the morning. In order that the knee joints do not press against each other, you can put a blanket between them or use a special pillow for pregnant women, one end of which is placed under the head, and the other between the knees. As for sleeping on your side, there are 2 important nuances that not everyone knows about. Meanwhile, they can devalue all the benefits of this position. Firstly, you should not bend the knee too much. When it bends at an angle of 90 degrees, the 4th and 5th vertebrae in the lower back twist, which provokes their inflammation and the development of arthritis. Secondly, the lower leg should always be bent slightly more than the upper. And thirdly, you can't put your arm to the side or put it under your head to avoid muscle stretching and neuropathy. So how do you change your habits and not fall asleep in unhealthy positions? There are 2 effective ways to do this. The first is to immediately lie down in an uncomfortable position, such as on your stomach. Feeling the tension in the neck and back even before you manage to fall asleep, you will naturally turn over in a comfortable position. And the second method is for those who toss and turn in their sleep. For this purpose, a small ball is sewn on the front of the pajamas in the chest area. If you turn over on your stomach in the middle of the night, the balloon will press on your chest, and you cannot sleep in that position. And one more recommendation for a healthy deep sleep: do before going to bed a simple gymnastics, alternate deep breaths and exhalations, counting to 6. At first, such long breaths and exhalations will be hard to do, so start with a smaller count and gradually bring it to 6. Healthy sleep is one of the most important parts of good health. We hope that these tips will help you get it right and solve all your problems. And if you have your own methods of solving your sleep problems, share them in the comments.